Well, taking a closer look now at a story we've been following, there has been another sharp increase in Ontario measles cases as the province begins to release weekly reports on the infectious disease. Public Health Ontario is reporting 470 measles cases since the outbreak began in October, an increase of 120 cases since March 14th. The spread resulted in 34 hospitalizations, including 2 people who needed intensive care. Most of those hospitalized were unvaccinated kids, including one of the intensive care patients. Symptoms include fever, a red blotchy rash, as you can see there, red watery eyes, and cough. There have been no reported measles cases in Ottawa. For more on this, we're joined now by Ottawa Public Health's Interim Medical Officer of Health, Dr. Trevor Arnason. Thank you so much for being here.
Thanks for having me.
Is it just a matter of time before we have a case here in Ottawa?
It's tough to say. Last year we thought we were going to have one as a matter of time because we were seeing a similar thing where there were importations of cases in many places in Canada, and we didn't actually end up having a confirmed case last year. So I don't think it's inevitable, but we're certainly expecting that we might see a case this year.
There is a vaccine for the measles, essentially eradicated at one point. Now, all of a sudden, last year, this year, a couple of other times, we're seeing these spikes in cases. What is happening?
Yeah, so the vaccine is extremely effective, and the only explanation for why we're seeing a return of the spread within North American locations is that people aren't vaccinated in certain places. We've never had 100% vaccination, but certainly we had high enough levels that it completely blocked the spread of measles. With the pandemic, there's been a lot of disruptions, and we're seeing that probably there's less people who are vaccinated fully against measles, and that's allowing it to spread once again.
You're hearing it a little bit here, maybe a little bit more in the States. A lot of us had measles when we were younger, not that big a deal. It's pretty miserable, though, isn't it?
Yeah, I think that's one of the things about our generation of even physicians and others haven't actually seen a lot of cases of measles or even varicella chickenpox. And these diseases can actually be quite severe. Measles can be quite severe. It can cause pneumonia, it can cause even neurological or brain damage and deafness and problems with vision. It's really not a disease that we want people to get.
So if there is an issue with people not keeping the vaccinations up to date, not bringing their kids in for vaccinations, how do you go about getting that message across? Is it through the schools? Is it more suspensions? Is it a bigger campaign? And are you concerned about possibly other diseases coming back?
Yeah, so right now we're in the process of proceeding with the enforcement of the Immunization of School Pupils Act, which is the act that requires children to be vaccinated or have a valid exemption to attend school. And that's one way to demonstrate the importance of these vaccinations, but it's also just another opportunity for people to realize whether they're up to date or not. Our goal is definitely not to suspend children. What we're looking to do is enable them to determine what vaccines they need. And measles is the sort of prototypical virus that can spread explosively in schools or other settings where people gather, and that's what we're seeing in certain parts of the province, and that's what we're trying to prevent by ensuring that most people are vaccinated in school.
All right, good stuff, good message. Appreciate you coming in.
Thanks very much.
Dr. Trevor Arnason, Ottawa's Interim Medical Officer of Health.